Welcome back to Homeopathy at Home with Melissa. Hi, Melissa.
Hey, Bree. It's so nice to see you again.
You too. And today we have a special guest with us to talk about IV nutrition, IV therapy. Is that what you call it?
That's
Okay.
it.
I am here as an ignorant bystander to ask questions. So I apologize for any silly questions. I'm usually the one who helps out all the people who don't know anything who are listening.
So that's why I love having Bree here, because she asks good questions. She really does. So I'm excited, Bree, about what questions you're going to come up with. Yeah.
I have a couple. So if you I don't know if I pronounce your name correctly. It's Ali Farabee.
That's it.
How do you say that? So welcome, Ali. Thank you for being here.
Absolutely. My pleasure. Thank you for having me.
Yeah. So I asked Ali to come on because I had such an amazing experience with IV therapy last summer. And so we were at the beach, and my husband came down with a flu-like illness. And we were using homeopathic remedies, which we always do, we still do. And he was just having a really hard time. He also wanted to rush the healing because he felt so bad, right? So he was like, just there was kind of an anxiety, not I'm not saying he had anxiety, but he was in such pain. I was like, okay, what can I do? I got to do something. What can I do? I found IV therapy. It wasn't the first time I'd ever heard of it, but it was the first time I had ever used it. And the results were amazing. I could not believe, as bad as he was, how fast he turned around within 12 hours. It was a complete turnaround. And so I was like, that's it, I'm sold. So I started recommending that people, if the homeopathic remedies weren't working fast enough, or if they were very sick, that they try to get IV therapy. And then, Ali, you happened to help my in-laws, which his dad and his stepmom, and they had an amazing experience. So I would love to know, Ali, first of all, if you would just introduce yourself, tell us a little bit about yourself, and then tell us about IV therapy, what it does, why it does what it does, and then we'll probably have some questions.
Sure thing. Well, thank you both so much for having me here. This is my passion, anything involved around health and wellness. And so I love speaking about it and just educating. But so I'm Ali Farabee. I have been a registered nurse for almost 19 years now. In just a couple of months, it will be 19 years. And I started out in pediatrics, actually, was there for about 8 years, worked in the children's hospital in the hospital system, and then went to a couple of different pediatric offices. And then I transitioned into health and wellness, and have really been in the health and wellness realm in one way or another for the past 10 plus years. And, I knew that helping people was definitely what I was meant to do here in this life. And of course, being a nurse, that's what nurses do, is we help people in whatever way. And a lot of times it looks like taking care of people and helping them to feel better. And, I have had an amazing career, and I worked for a very large healthcare corporation for majority of my nursing career. And it's been amazing. It's been so very rewarding. I've helped people in a lot of different ways, but it kind of got to a place where, just like life, everything changes. And as time changes and things happen, and I just was kind of, I guess, looking for more of a work-life balance. And I'm a wife, and I'm a mother of 2 kids, and they're both teenagers now, and they are super busy and they're super active. And of course, as a mom, I don't want to miss anything that they do. My daughter is a very competitive dancer, and my son is an athlete. He plays a lot of sports. And so we're always on the go. And I just really was looking for something that was a bit more conducive to mom life. And, only having a limited amount of years with them still at home, I just didn't want to miss anything. And I would say probably about 8 years ago, I really started digging into more of the health and wellness, just all things health and wellness. And about 5 years ago, my family unfortunately endured a really hard, unexpected diagnosis with my mom. And going through all of that, we were actually introduced to an alternative practitioner. And I got to say, that changed everything for me. That changed my life. That changed everything for the rest of my life, honestly, and led me to just digging and doing so much more research and learning about all the things that we have access to at our fingertips that we can do to help us feel better and get over things. And there was a lot going on. And, especially over the last several years where all of our lives have been impacted in many, many ways. Even though I was working in a wellness division where I was, things were just not necessarily going the way that I felt somewhere that I needed to be. And just, learning. And truthfully, I believe that the good Lord has given us all the things that we need on this earth to heal our bodies. We just have to know how to use them. And so, Melissa, thank goodness for people like you that have, done so much studying and research, and you're just a wealth of knowledge. And I just believe that the world just needs to be more familiar with that. We need to be educated so much better. And there was just a lot of things, with my corporate job that I just wasn't fully in alignment with, fully in agreement with. And I just felt like there are other ways that I can still be a nurse and I can help people. And I started my own wellness business a couple years ago, and it was just kind of one thing, led to another. And so it was the fall of 2021. I was able to walk away from my corporate nursing job, and hallelujah, it has been amazing, doing what I do now. But I really wanted to get into IV therapy and IV, supplementation, because I too, had learned how much of a benefit it really is. And so what I do is actually, I'm mobile. So I come to you wherever you are. I've been to many, many homes. I have been to many bedrooms. I have been to many couches. I've also been to many workplaces. You can get hooked up and work away if that's what you choose to do. And it truly was a pleasure, helping your in-laws. They were just precious, and I just enjoyed them so very much. And the fact that I can come to you, you don't have to get out of your pajamas. You don't have to get off of the couch. You don't have to get out of your bed. When you're sick and you have flu-like symptoms and maybe a stomach bug, maybe you have a migraine, maybe you've partied a little too hard the night before, and you have places that you've got to be, and you just need a quicker recovery. IV hydration, I truly believe it's, I don't want to call it a miracle because it's not, but it most definitely shortens the, whatever it is that you're dealing with, and kind of gets you over the hump and gets you feeling back to yourself much quicker. And it's giving the body natural things. So I do have just IV fluids like you would receive if you went to the hospital or to an urgent care, but I also have natural supplements. And so that's a big piece of, yes, we need the hydration, but especially if you're sick and you're not feeling well and you're trying to get over the flu or something like that, that's when the supplements come in, and you're giving that immune system a natural boost to kind of help you get on the other side and kick whatever has invaded your body. And it's been a pleasure. I love it so much. I scoot in, and usually in about an hour-ish, we're done, and I am on my way. And the client is on their way to feeling better much quicker.
Absolutely. Thank you so much for sharing that. And that is what I also love about what I can do with homeopathy. I love what you said, where you said they don't have to leave their house. So I remember as a kid having strep throat at least once every single year. And when I got strep throat, I would have a very high fever and I would be so lethargic and weak. And then I would have to get in the car and drive to the doctor's office, which was absolutely terrible. I mean, I remember that being one of the worst parts, other than them swabbing my throat and gagging me, that I would have to leave. I would have to get dressed and leave. Now, these days, people will just go in their pajamas. But back then, no, we didn't do that. We didn't do that. We had to take a shower and get dressed. And so it was just really terrible. And then to sit in the waiting room feeling terrible, sit in the room with the doctors, on the bed, waiting, all that was absolutely awful. And so with you and I, what we do is people can get our help and not have to leave their home and not have to, go and do all these things. I love that. So when people contact me for an acute consult, then I just help them right there. As soon as I see the consult come through, I'm on text. Now they might have to order or send somebody to go buy remedies if they don't already have what's on hand, which is why I highly encourage everybody to have a kit, a homeopathic kit, so that you can, if you have what you need, then we can just get started. You don't have to leave. And we can help that. And then IV therapy, gosh, to have somebody come to your house and help you feel so much better so fast. So what kind of things, what would you suggest for somebody with a flu-like illness? Because I know there are different concoctions. What would you suggest somebody get if they're sick and they need help?
Can I add on to your question?
Sure.
Corey, I don't want to ask it again or add on later. So to tag on to that, is that something we need to know? I know one of the overwhelming things for me was looking online and it's like, which one do you want? And I'm thinking, I'm already sick. I don't know. You tell me, So is that something somebody could just call you? Maybe what we should keep in mind so you can tell us ahead of time. We're not sick right now, hopefully. And if you are in a place where you're sick, would you go and you have recommendations for a person, or do they have to specifically know what they need?
Yes, great question. And I will answer both of those. So the immunity drip is definitely kind of the most popular, I guess, if you will, if you're not feeling well and you have symptoms that you're trying to get over faster. And that can look a couple different ways, but so we have set up drips, like you were saying. So you can choose, maybe you're sick and you want to recover faster. Maybe you're just lacking in energy. Maybe you were sick a while ago, but you're very fatigued and you just need something to give you a good energy boost. That we have an energy drip. There's also a recovery drip. There's a detox drip. There's some kind of geared specifically to athletes and performance. So yes, we do have standard drips. And Bree, just to kind of tag along with your question, I love it when somebody calls me or they text me or they message me and they say, hey, here's what I'm dealing with. What do you recommend? And then I'm more than happy to, say, okay, this is going to be your best bet, and just kind of give them, some examples or different choices that they can choose from, just depending on kind of what's going on. Also, if somebody has a migraine, I have different things that I can help with that. And that one is really amazing because, and actually at the gym this morning, I had a conversation with a girl who gets very frequent migraines. And she says, I have to go to the ER a lot because I have to get fluids and they have to give me certain IV medications. When after I've already had a headache and have been suffering for 4 days and I can't get over it on my own, then I have to go. And I said, let me give you my number because you don't have to get out of the bed or off the couch, and please don't wait 4 days because it's really almost instant. And, with the migraine drip, I walk in, they can hardly pick their head up off the pillow or off the couch. They really can't talk much at all because they're in excruciating pain, and noise is, doesn't help anything at all. And once about half of the bag gets in them, they kind of start perking up. They start talking to me a little bit more, moving a little bit more. And by the time that a liter of fluids has gone straight into their bloodstream and they've received some supplements to help them, they're literally almost a complete different person in about less than an hour. So that one is really awesome, because it is really almost instant for a majority of cases. And somebody that has flu-like symptoms or whatnot, a lot of it depends on your hydration status too. So if you are really dehydrated and all of a sudden you get a lot of fluids going straight to your bloodstream, you can kind of tell a difference when the bag is done. But really, like you said, Melissa, almost within 12 hours, you feel that perk and you feel that boost, and you're just like, wow, I can tell such a huge difference from 12 hours ago. And I kind of feel like a human again. I feel like I can get up and I can get dressed and I can do a couple things. And I tell people, it's not a miracle. It's not going to take away all of your symptoms that you have. But Melissa, specifically, I recall from your father-in-law, he had a lot of symptoms, but one of the worst things for him was his throat. His throat was absolutely killing him. And to be real honest, I didn't think that and I gave him, if I remember right, he got an immunity drip, which was vitamin B complex and vitamin C and zinc, I believe is what he got. And I remember checking back in with them the next day. And I remember her telling me, oh my gosh, it's amazing how much different he says his throat feels, and his throat feels so much better. And I wasn't really sure if it would help that specific symptom, but they seem to be, very, very pleased. And so it's so great when you know that you can pretty quickly and easily, you've got an initial stick that causes a little bit of discomfort, but other than that, it's very non-invasive, and it's quick and it's easy. And afterwards you feel like a new person.
Absolutely. So as one that has always been deathly afraid of needles because of my childhood experience with the penicillin shot, that really is what caused me to be afraid of needles. Most of you probably have never had a penicillin shot, but if you have, that shot in your hip or your butt, that thing is the most painful thing I've ever had other than childbirth. And so that's what caused me to be deathly afraid of needles. But then, of course, being pregnant, and I went down the regular, my 27-year-old just went down the regular path of going to the doctor with during pregnancy. So there were, was it during pregnancy? Maybe not, but at least during labor, when you go into the hospital to have a baby, they put an IV in. And so, but anyway, I've had IVs several times over the years for different reasons, and it's a pinch. It's not bad at all. And you just don't look. You just look away. If you're afraid of needles, just look away. It's a tiny little pinch. It's not bad at all. And so then I wanted to also say that the beauty of so the way we look at the IV therapy is it is such an enhancement to homeopathy, because homeopathy is working on a very deep level to uproot the tendency to get sick. And so it's not always fast. It can take some time to work. But the next time you get sick, if you get sick again with the same thing, the next time you get sick, it's shorter in duration and less severe than it was the last time. So that's what homeopathy is doing over time. So we have to always think long-term health versus short-term gratification when we're using homeopathy. But when you're in that much pain and you're that sick and you feel that terrible, then the IV therapy can come and just like, boom, help you feel better while homeopathy is uprooting the condition. So it's beautiful. It's such a beautiful thing that I really, really love. And I'm so thankful to have something to help people faster. Bree, did you think of any?
Yeah, I have like 5 questions.
Do it. I love it.
Because I really know nothing. I'm also laughing that I said IV nutrition, because that's literally I think I was thinking supplement. So that's just funny though. That's not the same thing. But okay, maybe I'll start. I don't know which one to start with first, but I do have a question about age of, like, what is the age and safety for like, could we do this pregnant, or if we have home birth mamas in labor, is that ever something you do, or postpartum, breastfeeding, all of the what moms think of? Is this safe, and like, are there good options for that for them?
Yes, absolutely. I have had several pregnant mamas, and um, and even, I'll throw this in there too. People that are getting ready to go into surgery, or maybe have just had surgery and they're trying to recover from surgery too. Again, I think a lot of people just aren't aware of how important your hydration status is in the role of healing and recovery. So anything really, all the things that you mentioned, and kids. So we do. I think that's kind of more of the kids are more of an individual basis. So kind of depending on what the situation is. I think in general, generally speaking, the fluids are typically always fine, because if your child gets sick and does have to go into the hospital, 9.5 times out of 10 they're definitely going to be hooked up to an IV. And we have a medical doctor that oversees everything, and so of course I'm able to go to him with any questions that I have. So if I have a pregnant mama or a breastfeeding mama, or a kid that the mom is really, wanting to get IV fluids for them, then of course I'm going to go straight to our medical director and say, hey, here's the situation. What can they have? What can't they have? And just make sure that, everything is good. And we have all of our clients fill out. It's a pretty brief patient questionnaire with a little bit of their history, just making sure that, they don't have anything that would be contraindicated here, which there's not a whole lot that's contraindicated. But like I said, of course, we want to make sure that everything is safe, and we're giving people the things that they need to help them to feel better. And, I haven't so far done any home births, but I would absolutely, hands down, love that so very much. Hydration again, and I don't know what the availability is for that. Right now, if there's a way to easily, get somebody into the home to give fluids. And I do think that would be such an amazing benefit to a laboring or post-labor mom at home. I think that would be absolutely amazing. And then you think about milk coming in and everything. I mean, it all goes hand in hand. So totally.
Well, I know one of the, sorry, keep going.
No, go ahead.
One of the hard things about treating, or maybe one of the fears we have as a mom, like when your little kid has a fever, or people get worried about dehydration, and that really is one of the biggest dangers, I guess, if there is going to be one. You would go in to just get fluids. So that would be nice to know. I also can do this at home. And that Melissa and I do, I mean, that's really the biggest part of what we do, is trying to empower people to take control of your healthcare for your family. But it's also one of the biggest reasons that if moms are having a home birth and transfer, I mean, I don't have statistics, but it's very often they're exhausted from lack of fluid. They go in to get fluids and they're good. They have that baby really quickly. It might be tricky in North Carolina because it's home birth and legal things in North Carolina. So, I mean, it may not be an option. You might have to look into that in your state, or what like the provider is safe doing. But I would wonder how that could change that for a lot of moms. So I also have another question. Okay. Is this good for prevention? Like if you've been around sick people, could I just say, hey, somebody I know has the flu or whatever, can you come, give me something good to help my body fight this, or not get that?
Yes, absolutely. So, and I do have a lot of those people too, where other members of their household are dealing with something and they just want to do everything they can to try to boost their immune system and hopefully avoid getting it themselves. Also kind of same as far as travel, especially if you're on a plane and you're around a million different people and germs and everything else, it is a great preventative, just to, again, give that immune system natural things, the vitamin C and the zinc and the B complex. And, you could add a couple other things to that just to give that immune system a natural boost. And I've had people before that have called and said, I think I'm coming down with something. I want to go ahead and nip it in the bud. I want to jump ahead of it. And I've gone over and I've given them the immunity drip. And then I check on them the next day and they're like, oh my gosh, I'm great. Like, I'm fine. I'm not sick. I did, and so that's a beautiful thing, is absolutely for prevention. You definitely can. And, just to add to that, a lot of people that maybe have, maybe they're dealing with cancer and maybe they're going the traditional route and they're receiving like a chemo or radiation or something, and they are so fatigued and they can't lift their head off the couch, and their body is just depleted of a lot of things that it needs from that. So IV hydration, with or without supplementation, is definitely been very beneficial for them, just to kind of give them that pep in their step and replace replace the things that their body has lost. And again, just general hydration, it's so imperative and crucial to everything. And sometimes people are, they're very dehydrated when I get there. And then sometimes, people aren't quite to that point. And I think too, that has a lot to do with kind of like how quickly they can feel the benefits and feel the difference of getting the fluids. But yes, I do preventative things a whole lot.
Okay, that's so interesting. This is great. I really came into this knowing nothing, so I'm learning a lot. Another question, and I only have a couple more. I think they kind of lump together. Are all of you created equal in this sense? Like, are all of the ingredients pretty much the same? Do we, who want to do more of the natural supplements, like we don't want junk going directly into our bloodstream? Is there anything we need to look out for? How do you pick a provider and know that they're trusted as far as ingredients or, like their sources and all that?
Mm-hmm. I can only speak for Fusion IV is the company that I am with, and our medical director is phenomenal. He is just he is such a book of wisdom and so very knowledgeable and so just willing to educate and to help and everything. I think and the medical director has to order the IV supplements from a pharmacy. I don't know that there's, and that's a great question that I can certainly ask. I don't know. I don't think I would put that in the same boat as, like oral supplements. Whereas, yes, there's definitely a lot of junk out there, and there's a lot of things.
You have to sift through, like, who do I trust? Where do they get their stuff? Is that just totally different when it comes to IV? Okay.
Yeah, I would say that's a totally different bucket.
Okay, that is good to know.
Yeah.
I think I have two more questions. Melissa, if you have questions, you just jump in, because I just have a couple more on my list.
So it sounds like maybe while I got kicked out, you asked what was in it.
Yeah, like how do we pick? Is everybody created equal? Do we have to sift through, like, where do you get your stuff, or are these synthetic or what? That's
what I wanted to know. So I'm glad you asked that. And I'll go and listen to the recording when I'm editing to see the answer since I got kicked out. Go ahead, Bree. I love it. I knew you would be such a asset to this podcast.
Okay, so are there any risks?
No, not really. I mean, one thing that, if someone had an extensive heart history, cardiac history, and kidney history, I would definitely, go straight to the doctor and just say, okay, I would gather more information about their history and a little bit more about them, and go to the doctor and find out, because there could be some cases where this may not be the best thing for them. Risk, there's really not. I mean, you may end up peeing a bit more just because you've given your body a lot more fluid. And then of course you've got, depending on how your veins are, some people are unfortunately not blessed with the greatest veins. And sometimes when you're sick and you're dehydrated, it makes your veins run and hide. And sometimes it makes it a little bit more difficult to find them. I do have some clients that I walk in and they're like, I'm sorry, but I'm a very difficult stick. And and I say, bless your heart, if I could give you mine, I totally would. But, you may have to end up being stuck more than once if your veins are not the greatest. And like I said, dehydration definitely plays a role in that as well. So maybe you may end up with some bruising at the site where we're trying to access the vein. Majority of times it's one stick. I get in pretty quickly and easily, and that's pretty much it. But no, I would say there's not really, there's no major risk or anything that you're giving your body. There may be some magnesium, potassium, chloride, some supplements within the bag of fluids, which would be like you were drinking an electrolyte drink, but this is just going straight to your bloodstream, which is why it is much quicker acting.
So effective. Yeah.
It's going straight there.
Yeah.
Thank you so
awesome.
much. You answered them like very well. I have
yeah.
no more questions now. I think that's all I had.
I'm glad you asked those questions. So I thought of another one. Is there any chance that somebody could be allergic to anything, and have a reaction?
There could be. And that one is, I can only think of, I can think of three times that there was kind of a little bit of a question. And if you're getting a drip with multiple supplements, let's say that you have 4 or 5 different supplements within the drip, and maybe, and I guess this kind of, I'll go back with risk as to what you just asked, Bree. So I've had a lady a small lady, has some medical history and was sick. So she was very dehydrated and was sick, and she got a supplement or a drip with several supplements in it. And she got hot, and she just, all of a sudden, she was kind of like, "Whew, I don't know if I'm getting nauseous or, what is happening here." And you kind of wonder, okay, are you maybe allergic, or your body's just not really liking something? Of course, when there's multiple things in there, it's a little bit difficult to figure out, okay, which one is it? Because it's probably one thing. It's probably not the whole thing. It's probably just maybe your body doesn't like B complex or something like that. But 9 times out of 10, if you just slow the drip down, because we have control as far as how fast or how slow it goes in. So in that case, I checked her blood pressure and just, made sure her blood pressure was okay. Turned the fan on and just turned the drip way down and slowed it way down. And once we did that, she was fine. Like, she was like, oh, okay, I feel so much better. So, you think about,
sorry, it's always so hard on here to know if it's lagging and I keep cutting you off. Do you think that could be because if she's been sick and you're giving her all these things to kickstart that immune system, could it also just be the body like kickstarting?
Yes. And I kind of, for anybody that has like a weird kind of feeling, I always go back to this. When I was pregnant and I was taking my prenatal vitamins, my body did not like that. So I was already sick, but they made me so super nauseous. So I had to find the right one. And I only could take it immediately before I went to bed. And that was the only way that I didn't get sick. And so somebody that takes, vitamins or supplements on a regular basis, you really should have food on your stomach, because you're giving your body a lot of things. And I think, yes, this is, kind of that exact same thing. And again, when you're sick and your body's depleted, it is, a lot of things pretty quickly all at one time. So, in that case, I usually just, I start slow. And as long as, you're not having any issues, I can speed it up a little faster, knowing that you're going to tolerate it well. And if you decide, hey, I'm feeling a little hot, or maybe a little nauseous or something like that, then I can always, we can pause it, we can stop it, we can turn it down and let it go in a little bit slower. But, and I was trying to think, I was going to give you, I think, one more example. And there was one lady, and she gets them pretty frequently, and she had someone else give her an IV drip, and she said it made her feel terrible. She said she felt awful, and she thought she was allergic to something. And I said, well, the only way to, and it didn't do anything to her other than she just felt yucky. So it didn't like harm her or anything. She just felt like blah. And I said, the only way to really figure that out is to just do one at a time. And I told her, I said, honestly, though, I think you probably just got too much at one time too quickly. I think if it had been slowed down, you probably wouldn't have felt like that. And I had someone the other day, and she's been getting them for a while through someone else. And this was the first time that I went to her, and she said, she said, I feel bad the day of. She said, every time, she said, I just don't feel good. And she said, but that morning, she said, the next day when I wake up, she said, I feel like $1,000,000. And she said, it is so worth me feeling not the greatest the day up, because I know when I wake up, it's going to be a different story.
Awesome. So Bree, I am on my regular internet, not the hotspot. So tell me just interrupt me if I start lagging. So since this is a homeopathy podcast, I want to discuss just a couple of homeopathic remedies that are great for flu-like illnesses that I would suggest for people to do. And, in addition to the IV therapy. And so before we got started, Bree and I were kind of discussing a few of our favorites. And I'm just going to say my two favorites. And then Bree, you can tell maybe what you has been your favorite. So gelsemium, either 30C or 200C every 3 hours for 24 hours, and then reassess how you're feeling, has been really amazing. So remember, gelsemium has the 4 Ds: dizzy, drowsy, droopy, and dull. Dull is the apathetic mind. Dizzy, of course, is self-explanatory. Drowsy is like malaise. It's fatigue and it's weakness. And droopy is the face can look droopy. So the person can look drugged. So another word that some people use instead of droopy is drugged. Not that you are drugged.
She froze again real quick. Not that you are drugged. I'll wait till she comes back and finishes, but that you look like the appearance of too much. So even like you can't keep your eyes open. You paused right where you were just saying that. You're good.
Okay, good. The droopiness, right?
Yeah.
The drug look in your face. So gelsemium, huge if you feel really weak. It also has a headache, especially in the front or in the back. And it can have nausea. So it really covers the flu symptoms beautifully. And then oscillocosynum is another great one that I really love. So some people say you have to use it at the very beginning or it's not going to work. That's not true. That's not what I see. I see oscillocosynum work at any time during the flu process. And even at the end, I can see it like get that person over that last bit. They're like, maybe gelsemium's just not quite getting it anymore. I haven't progressed. Oscillocosynum can like kick them over the edge and get it done at the end. And so those are my two favorite flu-like remedies. Of course, we've got all the coughing. So Bree, what was it you were saying earlier about coughing?
Yeah. Okay. So I'm not typically a big combo remedy person. But Chestol, I have seen work very well for the cough, for what's going around lately anyway. I do think sometimes they'll shift, remedies shift with the seasons or with whatever illness. But I've seen Chestol like really, and it's not like they stop coughing immediately, but it's where we've gone 24 hours trying maybe Drosera or Ipecac with a lot of mucus or the deep, harsh coughs that are gagging and stuff. And Chestol will move there and there's improvement. So remember that you're not going to wake up and your cough is gone in 3 hours when you have something like that. I mean, maybe you will. I have seen it happen, but a majority of the time it's not going to work that way. So like Chestol, I love belladonna, even if, so typically belladonna is a red hot high presentation. So red cheeks, high fever. And I, though, will use it when I know I'm getting something viral and I just feel it. But I typically do it with gelsemium, maybe rotate them, usually a 30 or 200. That works really well for me and one of my sons. And a silicosinum. I have also seen that this is the first year too that I've really seen it be a big remedy for many people. Maybe I just know more people using it, but it almost seems like, I'd love to know your thoughts on this, Melissa, where none of the symptoms are extreme. Like there's not a specific remedy that's sticking out to me, but they kind of have a little bit of everything lingering. Like you said, I've seen it work really well. Would you agree with that? Or is that just unique to what I've seen?
Had not thought of it that way, but that's very true. And in fact, now that you're saying it, and I'm thinking about the few people that I have on oscillocosinem right now, that's exactly what's been happening with them. They've been mild symptoms and just kind of feel really don't feel good, but it's not, big, huge bang, it doesn't have a ton of body pain.
That's what I was going to say. It's not the extreme body aches. I also have seen Roost Tox work well for a couple of people. That's just one. I usually use gelsemium, but there have been a couple times where it wasn't quite like eupatorium type of excruciating, but they can't sleep. They're really restless. They have a fever and that body ache. So Roost Tox actually has been a newer one for me. Yeah.
That's what I used last time I was sick, was Roost Tox and probably gelsemium. I'm such a gelsemium girl when I get sick. And
Yeah, you are.
Roost Tox really was helpful for me last time. And so is there anything else? You mentioned eupatorium. That's the extreme, excruciating body pain, and it really has no other use other than the flu, eupatorium. So, when we look at our Materia Medica, you look at this big fat book and you read a remedy, it's pages and pages long. Eupatorium basically is just flu. And it's body aches and flu. So it's not the only thing that I would take, but it is a good one. Yeah, so good. So we want to use our homeopathic remedies to uproot the condition and the tendency to get sick. Get the IV therapy if you can. And Ali, I would love for you to tell us how. So we all wish you traveled all over the country, but you probably don't. So for those of us that are local to you, how do we find you? How can we get you to come to our house?
Well, we do have a website. It's called fusionivtherapy.com. And again, my name's Ali Farabee. You can kind of go in and you can book an appointment with any of the nurse slots that are there, and you can look for my name. It's almost like I'm on call, actually, because you don't plan to get sick. You don't plan to get sick 2 weeks from today, and you need to schedule an appointment. So I am perfectly happy if someone is within the area and I am in town and I am available. I really don't care when it is that they need it. And most of the time when people find out about me and the service that I can provide, they want me to come yesterday. It's just they want it as soon as possible. And if I am able, I will come. So I really don't mind whenever it is, because I know what it's like to be miserable, and that something is going to help you kind of get over the hump, then I'm more than happy to do that. I do have some regular hours set up on the website. I'm perfectly fine for people to call me, text me, message me on social media and just say, hey, I heard about your services. When can you come? And like I said, if I am able, I will do my best to get there as soon as possible. And I have traveled a little bit. I've kind of been introduced to some, I guess you'll say VIP clients, I guess, where a physician has asked me to come, do some traveling, and they do kind of just cover my travel to get there. And I'm happy to do that. I'm pretty flexible. So if it works out, I'll do whatever I can. And I've kind of tossed around getting into more of the concierge, just because, like I said, I'm thinking, people are, I don't know anybody that wants to go to the ER or wants to go to the urgent care. And like, especially, if you're traveling and, hey, if I'm able and I can get wherever you are, I would certainly be able to discuss that with you and see if we can make it work, because it really is a game changer. And especially if you're away on a work trip or you've got to do something specific and, you've got really big plans and you need some pretty quick help to kind of get over it. So I'll be glad to provide my number or my information where people can get in touch with me. And like I said, the website, you can go on there. Of course, it's not 24/7 availability, but like I said, I'm happy to work with people and get to them as soon as I can.
Awesome. Thank you so much. Bree, do you have anything else?
No, but I learned so much. Thank you for being here, for answering all of those questions that I had. And it was really great to meet you.
Yes, absolutely. It was my pleasure. Thank y'all so much for having me.
Yeah, Ali, thank you for what you do, because I think it's amazing that you go into people's houses while they're sick, right? How many of us would be like, I don't want to do that, right? So we are extremely thankful for people like you who will come to us when we're sick and sit with us, and do an IV. And I can just imagine that you're just lovely and you just sit there and maybe have a conversation if they want to, or maybe not if they don't want to. And just there's no fear and there's no worry. And I'm sure you make the environment feel safe and comfortable. And my in-laws really loved you. They really talked about how well. Now I know that you and I live close to each other, so we have been, we've kind of known each other on Facebook for a while, but was super happy to know that you went to my in-laws when I recommended the company, and just so thankful that you came and shared your knowledge with us today. So we look forward to getting IV therapy when we need it. And I'm definitely calling you if I have anything come up where I need this. And again, thanks for being here. Keep doing what you're doing.
Absolutely. Well, thank both of you for everything that you do. This is such an amazing way to teach and educate people, and to show them, like you said, how to take control of the things that we can take control of. And I just love it so much. So thank y'all both very, very much.
Thank you.